Top Med Talk. So welcome to Journal Club Special with me, Monty Mython, Editor-in-Chief of Top Med Talk. So why special? Well, rather than one of our typical explorations of the research literature, I've chosen a series of articles in the April edition of Anesthesia and Analgesia. You'll find the links on the Top Med Talk website. Their featured articles are on anesthesiology and global health, and they've got one of their great infographics which really summarises this challenge we have. It's timely because this week at the Royal Society of Medicine on Friday the 13th of April will be the Safe T Summit. That's Safe Anesthesia for Everybody Today. The aims of the summit are to advance global patient safety agenda. Special guests include Tor Laerdal, who among other things is the Executive Director of the Laerdal Foundation, and Atul Gawande, who's Professor of Surgery at Harvard Medical School in the USA. It's organised by the Anaesthesia section of the Royal Society of Medicine and the World Federation of Societies of Anaesthesiologists. The details will be on the Top Med Talk website. That's www.topmedtalk.com. Here's a piece that the Top Med Talk team recorded with Dr. Liam Brennan, President of the Royal College of Anaesthetists, at ASA 2017 in Boston about anaesthesia and global health.
I'm Geoff Lacey, and once again I'm in the exhibition centre at the conference, right at the heart of things, surrounded by the latest innovative technology for use by anaesthesiologists. But for this podcast, I'm very excited to have a panel of guests in which we hope to discuss a very different, more fundamental need for the world of anaesthesia. I'm joined by Dr. Gonzalo Barrero, President of the World Federation of Societies of Anaesthesiologists, Julian Gore-Booth, the Chief Executive of the WFSA, Dr. Paul Clyburn, President of the Association of Anaesthetists of Great Britain and Ireland, which is a member society of the WFSA, and Dr. Liam Brennan, President of the Royal College of Anaesthetists, who in fact I'm very excited to say will now take over the discussion for what promises to be an insightful and interesting chat about the challenges facing global anaesthesia and the importance of why we step up and meet those demands.
Thanks, Geoff, and morning, everybody. We're sitting here in the trade hall of the World Congress on a breathtaking scale. This conference with 12 to 15,000 delegates, surrounded by the most high-tech medicine you can imagine. But we're going to talk about this morning, as Geoff has said, some of the real concerns that we have for the lack of unmet need for safe surgical anaesthesia care. So I'm going to turn first to Gonzalo. Morning, Gonzalo.
Morning.
Hope you're enjoying Boston.
Fantastic
city, isn't it? Yeah. So, Gonzalo, can you give us some idea of what is the scale of unmet surgical and anaesthesia need globally?
Okay, thank you very much for this exciting opportunity. I think that the first point that we have an unnoticed, very severe global disease. We are talking about 5 billion people out of 7 billion that do not have access to safe anesthesia and safe surgery in the world. And we leave aside that the other 2,000 billion are not doing very well in some countries. For example, those that are ketamine dependent, absolutely. This disease, this unnoticed disease, strangely unnoticed, kill 4 more times than tuberculosis, malaria, and HIV together. And we are talking about conditions that can be more or less easily treated by anesthesia and surgery.
Sure.
The other amazing point is that we all know what we need for safe anesthesia and safe surgery. We need infrastructure, dependent on governments, many times, or the majority of times.
Yep.
We need medication, we need equipment, and we need human resources, which is the most complicated issue.
Of course. So, in terms of Julian, turning now to you, Julian, what's the WFSA strategy to try and address this whole gulf of unmet need across the world?
Thank you, Liam, and thanks everybody. We're having an amazing time in Boston. The WFSA, just for those who may not know, is a global federation made up of 135 member national societies like the AAGBI and the ASA. And together these member societies cover 150 or so countries around the world with hundreds of thousands of anesthesiologists who make up that membership. That gives us an extraordinary resource that we draw from to be able to do two things. And those two things will be very familiar to anesthesia providers around the world. Number one is to improve patient safety. And number two, which is perhaps the newer axis, or the one that's less familiar to anesthesiologists, is to increase access to anesthesia. And those two things, safety and access, you have to do together without one compromising the other. And as you increase access to anesthesia, you cannot afford for patient safety to be compromised. And that's really the key challenge. To do that, we work in two areas. Advocacy is one, and education and training is the other. Many of us are very familiar with education and training, and that is a huge collaboration between colleges, national societies, industry, governments, and so on. The advocacy side of it is, again, an area where we're realizing that we have to step up, and we have to, as an anesthesia collective, we have to talk about anesthesia and surgery in global health decision-making fora. That means, for example, that the WFSA, which has official liaison with the WHO, must take advantage of being able to talk to the executive board of the WHO, being able to talk at the World Health Assembly of the WHO, and other multinational and international fora to bring the crisis of this extraordinary neglect in surgery and anesthesia to the attention of global decision makers. We have to start punching at our real weight. This is a global health crisis. It has been neglected for so many years, and advocacy is a key part of the response.
I couldn't agree more. And every death is a tragedy, of course. But so much of the publicity, as Gonzalo has said, has been focused around death from infectious disease. But as just to highlight that point, the numbers of deaths due to surgically amenable conditions is 5 times that number, probably of the scale of 18 to 20 million people a year are dying from that. And of course, we were also talking before we started the broadcast, Julian, about the economic aspect of this, which of course is the other dimension that will attract the attention of politicians. Do you want to say something about that?
Yeah, we're in an amazing position now. This is a seminal moment for anesthesia. In 2015, we had the publication of the Lancet Commission on Global Surgery. We also had the publication of the World Bank's DCP3, or Disease Control Priorities Report, alongside a World Health Assembly resolution agreed unanimously by the member states of the United Nations to strengthen essential surgery and anesthesia. And within those seminal documents is information and, if you like, policy-changing statistics and modelling that shows that there is a 10-to-1. For every $1 invested, there is a $10 return on investment in essential surgery and anesthesia, particularly at the district hospital level.
Sure.
And we know that globally, the district hospital level is really where we need to go, because that is where most surgery is being performed, and that is where we get most access to the global population, those 5 billion that do not have access today.
So turning now to Paul. Morning, Paul.
Morning.
So from the point of view of the UK, what's the UK doing to try and contribute to improving the practice in this area and meeting our global responsibilities? So from the association's perspective, do you want to tell us a little bit about that?
Well, I'd just like to pick up on something that Julian said, which is about the importance of people taking things forward and trying to improve safety and education. One of the problems in the UK, for example, and other countries, there are lots of great work being done overseas in lower middle income countries, but it's often working in silos. And I think one of the important things is to increase collaboration and partnership, particularly partnership with local anaesthetic societies in the individual countries. As far as education, the association recognised that a lot of the work being done was done very small scale and rather unstructured in terms of education. Lots of good intentions, but it was that lack of structure that was the issue. So we developed the SAFE anaesthesia course, and SAFE stands for, as an acronym for Safer Anaesthesia from Education. and we partner with the World Federation to deliver that throughout the world. And the initial subjects we took on were obstetrics and pediatrics, where there is a real need in many of the low-income countries. And the most recent development is of the safe operating room. And that's very exciting because that brings in a true multidisciplinary. Because again, it's not about anesthesia safety, it's about anesthesia and surgical and nursing safety. So this brings those teams together, and I'm really excited by this. The other thing with the SAFE course is that it's developed in partnership with local societies, and there is an attempt to develop the faculty, to teach the teachers, so that they can take on the course and deliver it in their own country themselves. And I think that's very important. I think it's wrong for us to just parachute in and do the education. We need to develop local resources, and through that we also develop leadership. Because the advocacy, we can only do so much from our own place. We also need to be getting the local leaders to be advocating as well, so they work together. And I think that's an important part of what SAFE is trying to do. It also has some very high-level indicators of impact built into the course. And that's very powerful because you can see improvements brought about by the education. And that's also good for getting some co-funding from other organisations, from government and that, where you can demonstrate the impact.
So, I think that's great initiatives that are coming from the UK. And from the Royal College of perspective, of Royal College of anaesthetists, we launched jointly with the association and with the WFSA the eSafe initiative, the second iteration of that. And this contains 100 interactive e-learning sessions covering the whole scope of anaesthesia practice, with 500 key articles covering clinical anaesthesia and the scientific knowledge underpinning safe anaesthesia practice. So that's been available now on the internet and also via USB sticks, and we were very proud to launch that just in London last Monday with the patron of the Royal College of Anaesthetists, Her Royal Highness the Princess Royal, Princess Anne, was in attendance. That was a really exciting occasion. Apart from that, we are also working on the MTI initiative, the Medical Training Initiative. This is an initiative across the UK that allows doctors to come from overseas to gain training in the UK. And in anaesthesia, we have around 80 doctors currently training in that initiative. They spend 2 years in the UK gaining anaesthesia training before returning to their home countries. So lots of really exciting initiatives. So what else can we do in the future before we wrap up this morning's conversation? Julian, where do you think we need to go next?
I think that anaesthesiologists, and I think that leaders in low-income and middle-income and high-income countries have to address the workforce gap. We know that safe anaesthesia is a product of workforce, as Gonzalo was saying, workforce, equipment and medicines and infrastructure. So if you know what it is that needs to be provided, and the international standards for a safe practice of anaesthesia describe this very well, it is possible to map the gap. And the first place to address it is workforce. But anaesthesiologists will have to study the very difficult question of how do anaesthesiologists take the leadership of anaesthesia provision, which could be and may need to include non-physician anaesthesia providers as well.
Gonzalo.
Well, I think that thinking on the big framework, we have a global problem. The global problems usually need global approaches. Because if not, we will be duplicating and overlapping efforts. And I think this is one of the main challenges we have. We have a lot of people that were really surprised or terrified by this reality, and they are trying to do things. And I think that our challenges as the World Federation is to put everybody under the umbrella and to articulate the efforts. I would say that also I'd like to add that next year, in April 13 in London, we will have the first safety summit with very prominent lecturers from surgery and anesthesia and industry. It will be a great effort trying to do the same.
And the details of that will be available on the WFSA website, I'm sure, and on the college and the association website.
Of course.
Paul.
Yes, I'm really looking forward to that conference. I think it'll be very useful. My key message would be we need to work together more. need to be multidisciplinary in our approach. We need to involve local leaders and develop local leadership, and we need to, as all the individual NGOs, need to work together much more collaboratively.
And the final message from me would be that we need to listen, and we need to listen to what local people need. It should be local solutions to local problems, not parachuting in a problem from the USA or the UK or any of the other highly industrialised nations. We need to listen to what works for local people. Over to you, John.
Sorry to, we're time limited, but that was, I hate to stop it, but a fabulous snapshot of the challenges faced by all of us, really, a joint responsibility to improve this much needed demand.
Top Med Talk.
Don't forget, Top Med Talk will be live from the EBPOM USA Masters course, a perioperative care practicum in Atlanta. Make sure you join us and check out our website for details of how we're streaming some of the events live from the course, www.topmedtalk.com.